Welcome to Dr. A for Animals, the podcast that gives you reliable answers to your questions about animal health and wellness and useful tools to help you help animals, whether in your own home or out in the wild. Together with expert guests, I'll give you information that is based on scientific research and clinical experience. I'm Dr. Charla Ansorge, a small animal and exotics veterinarian, and I'm so happy to share my love of animals with you. Let's get started. Hello, my friends. Today, I want to help you understand better your pet's medications. Our pets tend to get prescribed medication relatively frequently as part of their lifelong care. And unfortunately, that can come with some stress and some confusion. Sometimes when an animal is acutely ill, you might be sent home with multiple medications to manage them over the next week or 2 weeks or however long it ends up requiring. And it can be frustrating and difficult, especially if you have a cat or a small dog or an exotic pet that can be especially difficult to medicate. And you're going home on your own and trying to get those medications into that animal, especially if you aren't 100% clear on what each medication is for, how it works, what the side effects might be. So I'm going to help you get a basic foundation for managing your pet's medication and kind of understanding what's going on. So here we go. Firstly, you don't have to be perfect at dealing with all of this stuff, and it's okay for you to have lots of questions and some back and forth with your veterinarian to make sure that you're comfortable with everything that you're having to manage for your pet. There are so many reasons that we might be sending an animal home with medication. There's such a variety of conditions that we may need to address. It could be chronic conditions like arthritis or allergies, chronic kidney disease, heart disease, that kind of thing, where the animal may end up on medication lifelong. Or it may be a short-term condition like an infection, pancreatitis, an injury where they need to be on pain medication, post-surgical medications and that sort of thing. Maybe a serious disease like cancer where you're treating with some oral chemotherapy at home, or your basic monthly preventives for mainly dogs and cats and some of our other furry animals where they're getting some parasite control once a month or something like that. And veterinarians are choosing those medications based on the species that they're treating. They're dosing based on their size and their age and their lifestyle, and taking into account any other, comorbidities, concurrent medical conditions and that sort of thing, other medications that they may be on, because there can be interactions between different drugs. So there's a lot that goes into your veterinarian just choosing which medication is going to be appropriate for that specific individual animal. It's important to note that a lot of human medications can be very toxic to certain species. So definitely don't be tempted to treat on your own. If you have, say you have a cat that it has an injury and is limping, and you decide I'm going to give them some Tylenol, they could die from that. So don't do that. Always check with your veterinarian if it's something relatively benign. There are certainly lots of human medications that we do use in animals, but they need to be used appropriately, and often the dosing is very different because these other species metabolize drugs in a different way. So they may need actually a much higher dose than a human would need, or they may need a much lower dose than a human would need, or they may not be able to take that medication at all. So very important that your veterinarian is overseeing any medications that you are using in your animals, and don't be tempted to use something of your own to treat a pet without checking with your veterinarian, and ideally having your vet examine the patient for whatever the condition is, because there may be better options than something that you may have on hand at home. Although in a first aid situation, you may need to use some stuff that you have at home. So certainly you can reach out to your vet to talk about that kind of thing. So there are lots of different types of medications that we use, and they come in different formulations. So we've got tablets, we've got capsules, we've got liquid formulations, topical medications like eye drops, ear ointment, skin ointments and that sort of thing, sprays. There are injectable medications that might be just done in the hospital or that might be sent home with you to give to your pet, like insulin. or fluids, that kind of thing that you might have a tutorial in your vet clinic to learn how to do at home. There are some long-acting medications. There are not too many of those, but sometimes a long-acting antibiotic or steroid, although I'm not a huge fan of long-acting steroids, but those might be given in the clinic. You're generally not going to be giving those at home. And then there are compounded medications, and a compounded medication is made at a special pharmacy, a compounding pharmacy, to make the medication in a form that's not commercially available. So this is not a drug that is manufactured. It's using basically the raw form of the drug and putting it into a form that is going to hopefully work for an individual patient who, for whatever reason, cannot take the manufactured form of the drug. So say it's something like fluoxetine, which is Prozac. So we get Prozac at the drugstore. You get it in a tablet. It comes in certain strengths. If we have an animal that needs to be on that medication, but they're very tiny and can't, like a bird maybe, and won't take tablets, you can't give a 10 milligram tablet of fluoxetine or Prozac to a little, 300 gram parrot. So you may have to have that made at a compounding pharmacy into a liquid form so that it can be dosed at a small enough amount for a little bitty bird, and it'll be a liquid that you can give with a syringe instead of trying to get a tablet into a parrot, which that would be very difficult. Although it can be done in some birds by hiding it in a piece of fruit. We'll talk more about getting the medication into the animal later. But there are also flavored chewable tablets and things like that can be made at compounding pharmacies. Usually the liquid medications are flavored in some way to make them a little bit more palatable to the animal, although they're still not very tasty. Most medications don't taste very good. So they can be tricky to give as a liquid because there's a lot more flavor in a liquid than there is in a tablet or a capsule, which the coating of the tablet or the gel cap is usually hiding the flavor, the horrible, horrible flavor of most medications. So sometimes giving a liquid is actually a little bit more tricky. But in some cases, if it's not too bad tasting of a medication and they put some flavor in there, it might go more easily for an animal that's very difficult to medicate. And in some cases, there might even be a transdermal form of a medication that can be made. Methimazole, which is a treatment for hyperthyroidism, is a common one that we make into a transdermal gel because cats are sort of notorious for being difficult to give oral medications to. This transdermal gel can be rubbed on the skin on the inside of the ear, and the medication is absorbed through the skin. Now, there aren't a lot of medications that absorb well through the skin. It has to do with the molecular structure of the medication, whether or not it will absorb, and whether or not it will absorb enough that it's bioavailable in the body and at a high enough dose that it has the outcome that we're looking for. So if you get like a little bit of absorption, that's not super great because you're probably not going to get a high enough serum level of that drug for it to accomplish its target action. Compounding as a transdermal sounds great, like, oh gosh, that'll be so much easier. Can we just do every drug that way? Unfortunately, we cannot. There probably are a lot more drugs that will be eventually made into transdermal formulations, but we just don't have the studies on those drugs to know whether they work that way or not. So methimazole is one that has been studied well. Mirtazapine is another. This is a appetite stimulant, so that's very convenient in an animal that's not eating. You're not taking things well by mouth, maybe having vomiting and stomach upset. Having a transdermal appetite stimulant can be really, really helpful. But there aren't that many drugs that have been thoroughly studied to determine whether they can actually be delivered in that way. So a compounding pharmacy may make any drug into a transdermal formulation, but that doesn't mean that it's working. So if you've had an animal that's been on a transdermal medication and you were like, that medication didn't work for my pet, it might not be that the medication wasn't appropriate. It might just be that it wasn't absorbing well in that particular compounded form. So compounding medications can be incredibly helpful, but it is a little bit fraught. It is important that that compounding pharmacy is a bona fide compounding pharmacy, that it's not being done just in a clinic. So there are a lot of clinics, especially that handle exotic pets, that may be doing compounding in-house without having the proper certification to be able to do that. So if you're getting compounded medications, you do want to make sure that it's a certified compounding pharmacy and that they are doing it correctly, because just mixing some powdered drug in or crushed medication in with a flavored liquid is not compounding. And you're not ensuring that you have stable suspension, that for one, that isn't going to inactivate the drug, and for two, that is going to have the same dose in every little blob of liquid that you have, or the same dose in every little chew tab and that sort of thing. So it's really important that very specific guidelines are followed in creating these compounded formulations. So it does really need to be done in a pharmacy that's dedicated to compounding. So usually your veterinarian will get that prescription sent to a compounding pharmacy that they're familiar with and that they work with. So there may be a local one in your area, or they may be using a more of a nationwide pharmacy like Wedgwood that does a lot of pet medication compounding. So compounded medications can be great, but they're not ideal because they haven't been through the same testing for efficacy and safety and that sort of thing. So it's a little bit like if you've heard of generic drugs versus brand name drugs. The brand name drug is the one that generally comes out first. It's gone through all the FDA approval in this very specific formulation through this one specific drug company, and it will come out like Prozac. This is the first version of fluoxetine that was widely available for prescribing and that sort of thing, and it was made in a very specific way. And then later, over time, it becomes possible for other companies to make that drug. So they're making the so-called generic version. They can make it for cheaper and that sort of thing. But sometimes generic drugs are not exactly the same as the original. Their oversight is a little bit different. So the concentration of the medication in a generic tablet or a compounded tablet may not be exactly the same as the original manufactured drug, then it may not be perfect. Now, in general, they're fine. In general, you get the generic version of a drug and it's fine. And compounding medications made by a good quality compounding pharmacy generally are fine, but there can be a little bit more variability than the medication that is manufactured by the original drug company that did the FDA testing and all that kind of stuff. So it's important to be aware of that sort of thing. If we're having an animal that's having an unexpected reaction to a medication or something and it is compounded, or if they're not having any response to the medication and it's a compounded or generic drug, sometimes just trying to get them on the brand name original drug may make a difference. But in general, those medications are totally fine to go with those other forms. And sometimes we just don't have any choice, like in the case of treating a tiny little, like a baby bearded dragon or a little bird or something, we are kind of stuck with, we don't really have any other option but using a compounded medication because the doses that we need are so tiny. I also want to talk to you about what off-label use of drugs means. Oftentimes, your veterinarian will be prescribing a medication off-label. And what off-label means is that it's being used either at a dose or for a period of time or for a condition that it was not initially FDA approved for. So when a medication is first created by a drug company and it's going through that initial FDA approval, they will study the drug in a specific species or maybe a couple of species at specific doses for a specific period of time for a specific condition, or it might be a group of conditions that are related in some way, and that's where they will get their FDA approval. And that is a very costly and time-consuming procedure to go through all the FDA approval. It can take years for a drug to get approved and then get on the market, and that drug company is spending all this money and time to get that done before they're getting their money back. So once it's FDA approved and it's out there and they can sell the drug, there's not a lot of motivation for a drug company to widen the FDA approval. So, to allow it to be used for other conditions or something like that. Now, if there's a big financial incentive to, like they discover once the drug has been out in the world, like some of these GLP drugs that are out that were originally approved for treating diabetes, they discovered, oh, these people are losing a lot of weight. There's a lot of financial incentive to then get that drug FDA approved to treat weight, to treat obesity or overweight. So in a case like that, a drug company may then go and get the drug, go through the FDA approval to add a new indication for treatment for that drug. But in most cases, we'll find, this pain medication was approved for treating post-surgical pain in pets for 3 days post-op. That's what the FDA approval is for, but it's perfectly safe to give for a longer period of time or for a different reason, like an animal injured their leg. We want to use that same pain medication. Well, it's not FDA approved to use it for an injury. It's only FDA approved to use it post-op, but it works for an injury and it's safe. We know from safety profiles of the drug that it's safe to use and we can use it for other types of pain. Why not use that? Well, we do that all the time, and that is off-label use. So if the drug is only approved for using in a post-surgical patient for 3 days post-op and we use it in any other way, we use it to treat an animal that tore their cruciate ligament and we're treating them for 10 days with this pain medication, we're using it off-label. But it works, and we know that it works, and we know that it's safe because generally what happens is universities and other organizations will do research with those medications once they come out, and find out, oh, does this drug work for this other condition? Does it work if we give it for this long? Is it safe to use in this species? So these studies, as they start to come out, then become available to veterinarians, and then we figure out, oh, gosh, well, you can use this sedative in a bird, or you can use this pain medication in a frog, and wow, it still works. So now we have this new medication that we have access to that we can use for this animal, and we know that it's safe and effective because UC Davis School of Vet Med did a great study on it or something like that. So that's where we're coming up with our information for deciding when and how to use a medication off-label. And we're doing that very, very often in animals because so many of the drugs that we use have not gotten through FDA approval because the drug companies haven't put them through that rigorous process of FDA approval to be used for these different indications or in all this variety of species. Especially in the case of birds, there are hundreds of different species that are pet birds. There's no one that's going to go through FDA approval to get a drug approved for Amazon, the double yellow-headed Amazon parrot and a scarlet macaw and a Senegal parrot, that's just not going to happen. So, basically we're using the drugs off-label in all of those species because they're not going to go through FDA approval for that wide variety of species. So if your doctor mentions this is going to be off-label, or you go to another vet for a follow-up and they say, oh, this is off-label use of this drug, that doesn't mean anything bad. Now, there are times when it's not appropriate to use a drug in a different way. There may be some limitations or, so-called black box warnings that a drug cannot be used for a certain period of time in a certain species or something like that. So we do have to be very careful when we're choosing to use drugs off-label. The veterinarian does need to be using the drug appropriately and hopefully is doing that. But in most cases, when we're using off-label medications, we're doing it with a knowledge base that comes from research that was done after the drug was FDA approved, or maybe even before that, where we know that the drug is safe, it's effective, it can be used in this species for such and such period of time, and that sort of thing. So just to clarify what that means, that's not anything black markety or under the table or shady in any way. It is a normal part of daily life in a veterinary clinic that we're prescribing medications for off-label use. So that's all that means. So let's talk a little bit about what once a medication is prescribed, what is on the label of that bottle? And I do find that a lot of clients go home and don't ever read the label of the bottle. It's very important that you read the label, and the staff who is sending the medication home with you should be going over the label with you. And oftentimes, depending on your hospital and the way they work, your vet may also be sending a little written discharge note home that has those same directions on them. So you have kind of another thing to refer to, but always check the label on the bottle. Make sure that you're giving the correct dose. If your animal has been given a dose of 1/4 tablet twice a day, don't give 1 tablet twice a day. And don't give 1 tablet once a day. Make sure that you're following the directions correctly. So there are legal requirements for what needs to be on the label of any drug that's prescribed. And those legal requirements are the name of the drug, the dose that needs to be given, how often it needs to be given, and for how long, and also the strength of the medication. So the difference between dose and strength, the drug will come in some specific strength, which will be like 25 milligrams or 10 milligrams per milliliter if it's a liquid. So that's the strength of the medication, and that does not change for that particular drug. There might be, amoxicillin is going to come in a 100 milligram tablet and a 300 milligram tablet and a 500 milligram tablet, but every tablet in that bottle is going to be that strength. It also comes in, a 50 milligram per milliliter oral solution. So that whole bottle, 50 milligrams per milliliter. Your dose is the amount that you're giving the patient. So that might be a half tablet, or 12 and a half milligrams of that 25 milligram tablet, or it might be 0.5 milliliters. So you're giving 25 milligrams of that 50 milligram per milliliter solution. So the dose is the amount that you're actually giving the animal. So that all needs to be on the label. The expiration date of the drug also needs to be on the label, and do pay attention to that. If you have something that you have left over, let's say you had some pain medication that you were treating an animal with and they got better really quickly, they didn't need it anymore, you still have it on hand. Make sure that if you decide, they stubbed their toe, I'm going to give them a dose of their pain medication, make sure that it's not expired by very much. Now, it's not like the expiration date hits and all of a sudden the drug doesn't work anymore. Sometimes a medication is still effective for several months or longer after the expiration date, but it is gradually starting to lose efficacy after that expiration date, typically. So do be careful with that. And there are rare drugs where they actually will, the drug itself will start breaking down in a way that it may actually become unsafe to give after its expiration date. That's rare. There are only a few drugs that are like that, but we do want to be aware of that and not be using drugs for very long after their expiration date. And you should always be receiving either the package insert that's pre-printed that comes with the medication, or a printout that your clinic should be printing out that has a detailed drug information sheet, and it outlines potential adverse effects for one, but it also has the information about what the drug is and what it does and dosing information and that sort of thing. So you should be getting that information just like you do when you go to the pharmacy and pick up medications for yourself. You always should be getting sent home with a sheet that has all of the detailed information about the drug. And that way, you don't need to go do a wild online search and hear a bunch of kind of wacky and crazy, weird stories from different people who may not actually know the detailed information about the medication. So do keep in mind, there is a lot of misinformation out on the internet. So it's important to be careful and filter any information that you're getting from out in the world, and look at who it is that's talking about it. So if it's just kind of a random person who had a bad experience with something, oftentimes people will attribute a bad outcome to a medication that was prescribed when it didn't necessarily have anything to do with the medication. I've had people tell me stories about, my pet got this medication and then they had a stroke, and it turns out that there was 6 months between getting the medication and having the stroke, or that it wasn't actually a stroke. And people can make the connection in their mind when there really isn't a connection in real life. So, and then they will put these stories on the internet. So there is a lot of that kind of stuff out there. People have a lot of strong opinions that aren't necessarily coming from a solid knowledge base. So it's important to filter that information that you hear, and make sure that it's coming from a reliable source that has a background and an understanding of how medications work and what is a likely adverse reaction to a medication versus something that's probably not related at all. And also to talk to your vet about potential adverse reactions and read the materials that are included with the drug, because that stuff all should be listed. It is required for that stuff to be listed with the drug, so that you know what to look out for and you can be prepared if there is an adverse reaction. And I'll talk more about potential adverse reactions a little bit later in the episode. So that's the labeling info. And then there may be additional little stickers or notes on the label instructions that say something like give with food or give on an empty stomach. Do follow those, because oftentimes the way that a drug is metabolized can be significantly affected by the presence of food or not in the GI tract at the same time as the medication. So it is really important, if it specifically says to give with food or give without food, that you follow those instructions, because if you don't, the drug may not be absorbed and metabolized appropriately, so you may not get the full effect of the medication. Now, if you have a medication that you have to give on an empty stomach and it's causing tummy upset, definitely let your vet know. Don't just keep doing it if your pet is really uncomfortable with that medication. If it's causing a lot of stomach upset, if they're vomiting, within an hour or two of having the medication, or they're clearly, they're not eating well, or they're kind of like burpy, that kind of thing, they're definitely having tummy upset, then we want to address that either by adding a little anti-nausea medication or a GI protectant, or adjusting the dose or the timing, or sometimes, it's ideal to give a medication on an empty stomach, but it's okay to give it with food, but sometimes we may need to adjust the dose, that sort of thing. Sometimes you may get an instruction that says as needed, and that basically is for you to determine if your pet is in need of that particular medication. So it may be kind of a semi-maintenance medication. So for, maybe an animal that has inflammatory bowel disease or chronic kidney disease, where they have some bouts of nausea at times, you might have an anti-nausea medication that you can give as needed. Or for animals that have arthritis, but they're not quite at the point where they need a daily pain medication, they may have days where they've had higher exercise and then the next day they're really sore, so you may have a pain medication that's as needed. So that's for you to determine when you feel like the animal is showing signs that need to be addressed. So like we were talking about earlier, make sure that you read that label and you follow those directions. The timing of the medication, how long you need to give it, all that kind of stuff is on the label, and it is important to follow those directions unless you've had a discussion with your veterinarian after starting the medication and those instructions have been adjusted based on how the animal is responding to the medication. So if you have a medication that you need to give multiple times a day and you're not super great at remembering that, you probably want to put it on a calendar or put, a reminder alert in your phone, that sort of thing, because the timing can be very important. In most cases, when we're giving a drug twice a day, we want it roughly every 12 hours. It's not the end of the world if you're like an hour to either side of that, for the most part. Now, with some medications, like a seizure medication for a patient that has epilepsy, you do want to be as close to right on every 12 hours as you can. For insulin, the timing is more important as far as giving it close to food. So you want it as close to 12 hours apart as possible, but it's most important that you're giving it along with food. So it depends on the medication, but do follow those instructions as closely as you possibly can in order to make sure that the drug is working appropriately. If you're tapering a medication down, so oftentimes with a steroid, or if we're discontinuing an antidepressant, anti-anxiety medication that the pet has been on for like a year. Those medications often need to be tapered down slowly. So again, you might want to put it on a calendar so that you remember when you're adjusting the dose down, because it might be every few days that you're dropping the dose a little bit. So you want to make sure that you making it as easy on yourself as possible by putting it on a calendar, so you don't have to try to keep it in the top of your mind when we have so many other things going on in life. If your vet does send home a discharge note with written instructions, be sure to look over that, because sometimes there will be extra notes about a medication that won't fit on the label. So if there are some other extra little notes, they may be on that discharge note. So do make sure you read those. We put a lot of time and effort into writing those. So drives me crazy when I send those home and they clearly have not been read. So please read your discharge notes. So let's talk now about getting the medication into the pet. This can be one of the most challenging parts of living with an animal, is trying to give medication to an animal who doesn't want that medication, and you can't explain why you need to give it, or you can explain, but they may not get the gist of what you're saying. So I highly recommend, if you have an animal right now who is not on medication, and especially if you have a young animal who's more willing to accept new things, I recommend starting to work on training them to take certain types of treats and things that aren't medicated, that you can hide medication in later if you need to. So for instance, a pill pocket treat or pill assist treat or a pill paste. There are lots of different versions of this for dogs and cats that you can wrap around a pill to hide the pill. If you start using those treats as a regular treat with no medication hidden inside as early as possible in your pet's life, so that they learn to accept them and like them as a treat, they're much more likely to then take that when they're not feeling as well and they need to be on medication for some reason, if they're already used to getting that as a treat. So if you give that as a treat a couple times a week, and maybe every once in a while put a crunchy treat inside, so they're kind of used to the feeling of there's something in there. But I wouldn't do that regularly, because if they really like the crunchy treats, they might crunch on it on purpose. And if you're putting a pill in it at some point, you actually don't really want them to crunch on it. So for the most part, just give those types of treats just kind of on their own. So that your pet will be kind of used to getting that kind of thing. Now, if you have an exotic animal that you would need to give medication to in a liquid form, you want to get them used to what a syringe looks like and used to taking something tasty out of a syringe. So if you don't have syringes left over from some other occasion, you can usually get them from your veterinarian. And usually you're going to want a 1 ml or 1 milliliter syringe. And you can start by just introducing the syringe and then giving your pet one of their favorite treats and just show them the syringe. So a lot of times, especially in the case of birds who tend to have a condition called neophobia, which is a fear of new things, they will be scared of just the syringe. So just the syringe coming towards them, they'll be like, oh my God, what is that? And move away. And especially if you walk up and try to show it directly to them and kind of put it in their face, they're going to be freaked out by that. So you want to slowly introduce it and have it several inches away to a point where they're not having a reaction to it. So they see it and they're looking at it, but they're not scared of it coming at them. And then give them some treats and then kind of work closer to, if they're willing to accept it and pick it up and look at it. Or if it's a reptile or somebody and they're kind of nonchalant about it, they don't really care. Just make sure that they can sense it, it's near them. And then you're giving them some other kind of treat that they like. If they like treats, if they're not super into treats, then give them something else that they enjoy, whether that's being petted, being interacted with, just having some verbal positive reinforcement, or a toy to play with that they really like, so that they're starting to associate that syringe. And you can do this with dogs and cats too, because you certainly may be giving liquid medication to dogs and cats as well. So that this can work for anybody. And definitely bunny rabbits, rodents, any of those little smaller furry animals, we're often using a liquid medication. So any of those guys, just getting them used to the look and feel of a syringe, and then you can just put a liquid in there that has a pleasant flavor, and start giving them little drops of that with the syringe. So for a cat, that might be a little bit of tuna juice or chicken broth, or a little baby food, or some pureed canned food, or the little squeeze-up treats like a churu or a delectable. You can put in a syringe and just get them kind of used to taking that out of the syringe. For birds, it might be just a little bit of fruit juice, a teeny bit. We don't want to give too much like high sugar food, but a little, a few little drops of fruit juice out of a syringe. Or you could do like a pureed oatmeal or baby food oatmeal. For rabbits and rodents, you can actually get a hand feeding mash that you can mix with hot water, and you can give that a little bit of that through a syringe. Most of them actually really like the taste of that. Or you also can do like the baby food oatmeal, or a little bit of yogurt, like a fruit yogurt. Again, not too much, because we don't want to be giving them too much sugar. Our little animals are susceptible to diabetes, type 2 diabetes, just like we are, unfortunately. So we don't want to be frequently giving them a lot of sugar. But if you can start working on training them to accept some form of treat that you'll be able to put a pill into, or a syringe with something relatively good tasting, then when the time comes that you need to give medication, you can use that strategy. And what you'll do is you'll give the treat with the medication in it, and then immediately follow that with the same device with something that doesn't have medication in it. So you would give like the pill pocket with the pill inside, give that, and then immediately give them another treat that's one of their favorite treats, so that they don't spend too much time like chewing or working on the pill pocket that has the pill in it. So we don't want that. We don't want them to be like, this is my only treat, I'm going to really enjoy this. We want them to be like, oh my gosh, there's another treat, I better hurry and take the next treat. And similarly, if you're giving a liquid medication that now there's medication in there, it has a very different flavor from what your pet is used to. You're going to want to try to get that in, and then immediately follow with something really yummy that they're used to getting. And you might even first give a little bit of the yummy, then give a little medication, and then give a little more yummy stuff. And that way, the whole process is just much less stressful for your animal, and for you, because I know a lot of people get extremely stressed trying to get medication into their pets. And this is one of the most important things that I can say to you is try to head into the situation as relaxed as you can be. Because if you're nervous about giving medication to your animals and you're stressed out about it and you're tense, and you go to them thinking that this is going to be difficult and stressful, they will pick up on your body language and your tension, and they will also feel really tense, and they're much more likely to resist being medicated. And the whole thing will just spiral from there. So try to create a calm routine and try to relax. Plan to give your medication at about the same time each day, at a time when you will have time to do it. So don't be like 2 minutes before you're going to leave for work, oh, I got to give the medication to the cat. That's going to stress you both out. And if it ends up taking longer than you think and you're getting stressed out because now you're going to be late for work, the whole thing is just going to blow up in your face, and it's not going to be fun. You're going to be stressed, they're going to be stressed, and they may end up not getting their medication, which could be very detrimental to the pet. So we don't want that. So try to take a deep breath, think positive. This isn't that big a deal. Animals get medications every day, and it can go very smoothly and very easily. I will make a video for you showing you how to give a pill to a cat, and I will show you that it doesn't have to be stressful and awful. So try to talk yourself into being as relaxed about it as you possibly can and thinking positive. Now, especially if you have an animal that you haven't had a chance to do any training with, maybe you right now, as you're listening to this podcast, you already have a pet who needs to be on medication, and it's too late to do the training and take it slow. If that's the case, you just have to get in there and give the medication. I definitely recommend trying using treat methods. There are lots of different things that we can do to kind of disguise medication and disguise the taste of the pill and make it look like they're getting some kind of a treat or they're getting it in their food. And if we can get away with doing that, that's the best way to get medication into an animal. So if they will eat it, not realizing that they're eating medication, that's great. If not, we need to be able to develop the skills to give the medication directly to the animal. So I'm going to just kind of walk you through some different various options for trying to give medication if you haven't had a chance to pre-train your animal to kind of already accept things. So it's always worthwhile trying, a pill pocket treat, a pill paste, any other kind of treat for, if you have animals, some of your exotic animals, if they eat berries or something, sometimes like a blueberry, you can kind of hide a pill in. If you have a snake and, if as long as they're eating, you can hide medication in their, like in a mouse. If you're feeding a frozen dead prey animal, you can hide your medication in there. Although most snakes don't eat very often and they may need the medication more frequently than they're going to eat. So you're probably going to only be able to do that part of the time. A lot of their medications are only given like every 3 or 4 days because their metabolism is quite slow, but you still probably aren't feeding that often for most of them. But for some of the other animals that will take like a berry or something like that, you might be able to hide the medication in there. You just have to watch very closely and make sure that they are eating it. So don't hide medication in one piece of food and then put it in with a bunch of other food and walk away. You need to give, if you're giving it with some food, you need to give it in a small amount and watch and make sure that the animal actually eats it. They have eaten the whole dose of medication, and then you give the rest of their food. Now, I don't recommend trying to hide medication directly in food, like a naked pill or liquid medication just mixed in the regular meal, for several reasons. One of them is if they taste it in there and they decide they don't like that, they may not eat their food. And then not only did they not get the full dose of medication, they also are not getting their food. And especially if they're sick, they need to be getting their food. We want to make sure, especially if it's an animal that's somewhat debilitated, we want to make sure that they're getting good nutrition. Another thing that can happen is they can actually develop a food aversion to the food that they have been eating because it suddenly tasted bad. And this is especially true for cats and small dogs who can be extra picky. If you have a Yorkie, you may have one of the pickiest animals on the face of the earth. If you mix medication in their regular meal and they smell it or taste it, they may decide they're never going to eat that food ever again. And if they're one of those animals that eats one kind of food, then you're kind of in a bad place, right? So we don't want to run that risk. So I don't recommend just mixing medication in with the food and hoping that they'll eat it, because most of the time they won't. There are a few medications that really don't taste that bad that you may be able to get away with that with. And there are some animals that are just like, I'll eat anything. And you can get away with that. And that's great. If you have one of those animals and they're like, they don't care, you may be able to get away with that. And they may not even notice, especially if you have a lab or a golden retriever, they may just eat it in their food and that's fine. So if they do that, that's great. But in general, I don't recommend doing that. If you want to give the medication in the food, then wrap the pill in a treat that tastes okay, even if they don't particularly like that treat. As long as that treat doesn't taste bad, it will hide the bitterness or nastiness of the pill, especially if it's a pill that you're needing to cut in half or something. That cut edge can be really, really bitter and horrible. So if you wrap that in some other treat, you can use like a little piece of cheese that you kind of warm up and roll around and cover the outside of the treat, wrap it really nice and tight, and then put that in like a spoonful of yummy food, like a canned food, something moist that you can kind of mix it in with, and offer that first. And then if they eat that whole thing, then give them the rest of their meal. So you can kind of disguise it that way. Some other stuff you can do if you have a pet that likes freeze-dried treats, you can put the pill, and you might have to cut the pill into smaller pieces, but you can buy empty gel caps, so the little capsules at the drugstore, and you might need to break up your pill into smaller pieces, stuff those inside the capsule, and then put that in with some crumbled freeze-dried food. And a lot of times they'll eat all of that stuff and eat the capsule because the gel cap kind of just sort of blends in with the freeze-dried treat. And so a lot of times they'll eat that whole thing. My brother uses this for one of his kitties. And I think they're using like Bonita flakes or the freeze-dried chicken for their kitty. And that she'll just eat the capsule and doesn't even realize it because it just kind of blends in with the texture and stuff of the freeze-dried food. So, and that's something you might even be able to get away with some of the exotics if they eat like a freeze-dried fruit treat or vegetable. You might be able to get away with doing that too. So you can experiment with these different things. And sometimes, the experiment's not going to work and then you need to get the pill out. And, if it hasn't dissolved in whatever you've done, then you'll need to give the pill. So there are lots of other little food tricks that we can try, and I'll put together kind of a handout that I'll have on my Instagram page for you that kind of outlines a bunch of different ideas for how you can approach giving medication without having to stick it down their throat, so especially if you have an animal that gets super wiggly or tries to bite you if you're handling their face or something like that, and you need to have some other method of getting medication into them. There are lots of kind of creative things that you can do to try to get the medication into them. Now, if you try a couple things and they don't work and your medication sort of gets wasted, and you need to replace those doses, like if it's an antibiotic and they need to be on it for 7 days or 10 days or whatever, if you run out of medication, let your vet know. Just let them know, hey, I tried to get it into them this way, it didn't work, so I need a couple of replacement tabs. They should be totally fine to give that to you. The only time when that might be an issue would be with a controlled drug. So before giving a controlled drug, make sure that you have a good method of getting the medication into the animal so that you're not wasting that. Because if you call your vet and say, hey, I need 5 more tabs of methadone, that's not going to go so well. But if it's an antibiotic or, a run-of-the-mill non-controlled drug, that should be fine. Another method for getting pills in would be to use, it's called a pill gun. It's kind of like a plastic syringe plunger. And it has a little soft rubber or silicone tip where you put the pill in, and then you just kind of wiggle that into their mouth, try to get it towards the back of the mouth, and then you pop the little plunger and it kind of shoots the pill into the back of the throat. Those are okay. I consider those kind of a last resort if that's the only way you can get the medication into the animal. It's not as friendly an approach. It's kind of unpleasant for the pet. It's not horrible. It's not going to hurt them, but it is a little more aversive. So I don't recommend just going straight to the pill gun method, but trying some of these other things first. And then if that's just really not working, kind of you have a pill gun as your last resort. So before the pill gun, I would, if you've tried all of the treat options, you've tried hiding stuff in some tasty food and things like that, you're giving lots of positive reinforcement, you're trying to remain calm and make this a positive experience for your pet, and that's not working, and you need to give a pill. The technique for giving a pill for most animals, now for most of your exotics, you're not going to be prescribed a pill. Possibly for some of the birds, like chickens and that sort of thing, you kind of are going to use the same technique that you would with a dog or cat. It's just that you're handling a beak instead of lips and teeth. But the important thing is to know the technique and to do it as quickly and smoothly as you can so that it's minimally stressful for your pet. And I'm going to describe this technique to you, but I am also going to make a video for you where I will demonstrate it. And I'll put a link to that video that I'll have on my Instagram. So, basically you want to have your pet facing the same direction as you. So they're sitting kind of right in front of you. I often will sit on the floor and have the cat. This can be a cat, a small dog, any animal that you're giving a tablet to, but I'll often have them just sitting kind of between my knees and have my feet together behind them so they can't back out underneath me. So I'm kind of stabilizing them just gently with my knees. With my non-dominant hand, I'm putting my hand around each corner of the mouth and then lifting their head. And this is the most important part. You lift their head so they're looking up at you and you're sort of straightening out the neck. If you try to stick a pill into an animal's mouth when their head is in a normal position with the neck curved, they will spit the pill out. They will be very, very skilled at spitting the pill out. If you tip their little chin up, so they're kind of looking up at you and their neck is sort of straightened out, you're going to have much more success with getting the pill to actually drop down the back of the throat and they'll swallow it. So you're with your non-dominant hand, you're gently but firmly grasping their little face kind of around the corners of the mouth and lifting their face up towards you. And then you have the pill in your dominant hand. You have between your thumb and forefinger, and then you're going to take your middle finger and lower their little chin, pop the pill in like right down the middle of the tongue, and then close their mouth real quick. Hold their mouth closed just for a couple seconds and maybe stroke their neck a little bit. That tends to stimulate a swallow. So then they'll swallow the pill and then you're done. Give them a little kiss on the head and then give them some treats. Have your treats ready and give them their favorite treats right away. Or if they're not very food motivated, if they like to be petted or brushed, or if they have a favorite toy, make sure you have that ready and you give that to them immediately after you give the medication. You want to make sure that you give something that they really enjoy right after you give medication. And during a period when you're having to medicate your pet daily, I would reserve that favorite thing that they love for medication time. So my cat has to have medication every day for his entire life. And he tells me when it's about 8:00 at night, he sits there waiting for me and is meow, meow. He's ready for his meds and treats. I'm sure he doesn't really want the meds, but he takes them because he knows he immediately gets his treats. And that is when he gets treats. So it's really, really helpful to kind of make a deal with them so that they will take their medication because they know as soon as they've gotten through that, they're going to get their favorite thing. So that if that's the time when they get that, it makes it a whole lot easier because they will learn that really, really quickly. So that's kind of the general technique for giving a pill to an animal. If you're giving liquid medication, you kind of want to hold them in that similar position so that you can kind of hold and stabilize their head a little bit. And then you just need to get that syringe kind of up under the lip into the mouth. And then don't squirt a whole huge dose of medication in their mouth all at once. If you're giving a liquid medication that's a small amount, you probably can squirt the whole thing at once. If it's, if it's going to be like several drops. If it's a relatively large amount of medication, like if you go squirt that whole thing in their mouth and most of it just comes right back out, it's just too much liquid to put in their mouth at one time, especially if something that really doesn't taste good. So you need to kind of perfect the slow and steady stream of medication where you're giving kind of a dribble and giving them time to kind of lick and swallow. Or you give a little bit and then you pause, give them a second to swallow, give a little bit more, pause, and then give the rest. So we don't want to be waterboarding our pets, like throwing a whole bunch of liquid in their face. You have to be careful if you're giving like 1 or 2 milliliters to a cat or a small dog, you need to do that in 2 to 3 kind of little pumps, or a slow, steady stream if they're kind of licking it up and it doesn't taste terrible. If you're giving, it might even be 0.2 or 0.3 milliliters to a small bird or a bunny, you probably need to go also in a few little plunges and not do it all at one time. So that is really important to not just kind of try to shoot it all in one go. If you're giving a really small amount of something, maybe a pain medication like buprenorphine that you're giving to a cat or small dog or potentially a bunny or something, that's usually going to be a really small amount. It's absorbed through the gums. They're not even supposed to swallow it, so that you can just shoot right under the lip, kind of into the little cheek pouch. So it hits the mucous membranes and then it's absorbed through the mucous membranes. So that's a little bit different. It is liquid, but it's a little bit different. Now, if you are going to hand medicate, so none of the treat or food versions are working and you have to actually give the medication to the pet directly. If you have an animal who's super handsy and is pawing at you and potentially clawing at you when you go to try to open their mouth, there's a little towel wrap that you can do. And so if you place your pet on the towel first, and you need to have about probably 3 to 4 inches of towel kind of beyond their little feet, and then pop that towel up right around the base of the neck, kind of upper chest, and then wrap it like a little scarf around their back. So you cross over one shoulder, then cross over the other. So you have kind of a nice little kitty burrito or doggy burrito. So you have them just kind of gently wrapped up in the towel, and you can keep their feet out of your way if they tend to kind of bring those little hands up and try to get you out of their mouth. Doing that little towel wrap can be really helpful. It might take a few tries to get used to it, and so you might want to do it a few times during the day when you're not actually medicating, and then just give them a couple treats so they're not too put off by you doing the towel wrap, so that you can get used to doing it really quickly. So I can generally do, like, put the cat on the towel, pull it up, wrap, and the towel wrap is on. So I'm not sitting there for 3 minutes struggling to get the cat wrapped in the towel. If you practice it a few times, it can actually go pretty quickly. And sometimes it's snuggly and it's warm and they're like, oh, this is kind of nice. Oh, wait a minute. Are you giving me a pill? What? And then you're done. So if you get really comfortable with it, it can go quite smoothly and make things a lot easier. If you need to give multiple pills or capsules to a pet, if they're small enough, you may be able to put them together as long as they can be given at the same time, which most medications can, but every once in a while you'll have a medication that has to be given separately from other stuff. So pay attention to that timing. But if they're fine to give at the same time, you may be able to put both pills in one pill pocket and roll it up if you're having to hand pill your pet. And that way you only have to do the pilling once. So you have them kind of in a little blob together in one pill pocket type treat, and give that all at once, and then you don't have to do it multiple times. So topical medications are a little bit of a different situation. So if you're applying something just to skin, like we have irritated skin or something like that, and you're doing an ointment or a spray, usually those go pretty well, unless the animal is really super uncomfortable. Hopefully, in that case, we're using a spray and not an ointment that we have to kind of rub on. If you're using a spray and your pet is reactive to the sound of the spritz, you might need to spritz it elsewhere away from your pet, onto like a cotton ball or a gauze square or something, and kind of get that a little bit soaked with the spray and then pat that onto the skin. So that can help if they get really nervous or freaked out by the sound of the spray. And if you're using an ointment, it's going to be a little bit icky initially. You want to make sure that your pet's not able to lick it off. So if it's in a spot that's easy for them to lick at it, they either need to be wearing an e-collar for a bit, or you need to distract them really well for a good probably 10 to 15 minutes if it's an ointment. And about 5 minutes should be fine if it's a spray, because those will kind of evaporate and dry more quickly. But you do want to make sure that they don't just lick that stuff off. And that goes for, topical parasite preventives as well. If you're doing a monthly parasite preventive, you do want to make sure that your pet can't reach around and lick that off, because they'll get a much higher concentration of the medication in their system really quickly. And that could cause a more significant adverse reaction. So we don't want them to have a sudden overdose kind of situation. So make sure that they can't just lick this stuff up. Also, if you're applying an ointment or a spray to irritated skin, it's not going to work very well if they lick it off immediately. So do make sure that they can't do that. Now, for ear ointments, this can be a little bit tricky for an animal that's uncomfortable, especially an animal that's had like lots of ear infections, recurrent ear infections. They can be pretty shy about having their ears handled. They might be a bit reactive to that. So you need to kind of take it really slowly and smoothly, where you're kind of comforting them and just petting them, and then just kind of gently picking up that ear, and then bloop, couple little drops of that medication in there. With ear ointments, if you're doing an ear ointment, generally you're going to get it down in the ear canal, and then you want to do a nice little massage around the base of the ear to kind of work that down into the canal. If you're just getting a couple drops right up at the outside of the ear, it may not be getting all the way down into the ear canal. So, ideally, if your pet will let you, you're getting that nozzle like right down in the ear. You're getting it like into the outer part of the ear canal, and then squeezing, and then doing your little massage to kind of work it down into the ear canal, and try to prevent them from shaking their head, which they will probably want to do until the medication has time to kind of sink down into the ear canal. So kind of hold their head a little bit steady. And of course, giving them treats while you're doing this is really helpful. If you can have a person kind of handing treats while you're giving the medication, or you can spread like a squeezable treat, or, for dogs and some cats, peanut butter or something. Just make sure there's no xylitol in your peanut butter. You can spread that on like a silicone mat. or a big plate, and then, so they can be kind of licking that. For kitties, the little squeezy treats. Ferrets love Laxatone. I don't know why, but they just, most ferrets love Laxatone. So you can do a little bit of that while you're giving some kind of medication to them. So try to keep them kind of distracted while you're getting the medication on board, and hopefully it will go more smoothly. For eye medications, an animal can be pretty freaked out by you're trying to put something in my eye. I know I get freaked out when I have to go and have anything done with my eyes. Other people touching my eyes really freaks me out. I don't like it. So I completely understand where they're coming from. So again, you want to take a nice, gentle approach. Try to be sort of petting them, petting around the face, and then gently lift the eyelid and then plop that little drop in there. If your pet is kind of squeezing their eyes shut when you're trying to put an eye drop in, that is usually okay as long as you can get right into the corner of the eye closest to the nose. So that's called the medial canthus. It's just the little corner there. If you can just get that tiny bit open and you get a drop in there. Most of our pets have third eyelids, and that third eyelid will come up and flick the drop across the surface of the eye. As long as you get it right in the middle, and it'll kind of suck in there and then get distributed across the eye. So you don't have to be peeling their eye wide open. If you can keep the eye open and get the drop kind of right in the middle, that's great. But if your pet is really kind of flinching and they're squeezing, kind of trying to squeeze their eye shut, as long as you get like just that little slit open and get it right in that middle spot, towards the nose, you'll get it in there. So it can be challenging, especially with a really wiggly pet, but it can be done. And for those transdermal medications that you're rubbing on the inside of the ear where there's no fur, you're rubbing right on the skin. Firstly, make sure that you are protecting yourself from getting the drug. So wear a little glove while you're putting the medication on. If you're in a rush and you do it without a glove, make sure that you wash your hands really thoroughly, but I don't recommend doing that. I recommend that you just wear a glove so you don't have any risk of absorbing the medication yourself, because it could be detrimental to you. You don't want to give yourself hypothyroid because you're treating your hyperthyroid cat with a drug that inhibits their thyroid function. So now when you do the medication on the inside of the ear flap, you want to be watching for irritation to the skin. So some animals will have a reaction to the medication on the skin. So if their ear is getting really irritated, you want to make sure that you're addressing that. You might need to get a different formulation. Sometimes it's more the carrier than the drug itself that's irritating the skin. So it may be that you just have to have it compounded by a different pharmacy that makes it a little bit differently, or the pharmacy that you use might have multiple different versions. The most important thing, though, is that you make sure that you're cleaning away any dried old ointment every day. So you want to alternate ears with each dose. And so when you go to do your next dose, clean the first ear that you used last time, clean off any debris, and you can just use a little, like a cotton ball with a little bit of warm water, and just kind of lightly soak that and rub it away, or like a gauze square. Just gently, soften the stuff up with a little bit of warm water if you need to, and then wipe it away. Make sure that debris is not sitting there on the skin all the time. That is not good for their skin at all. So clean up that first ear and then put the fresh dose on the other ear. And then when you go the next time, you're going to just alternate your ear to ear. Now, giving injectable medications at home is a bit less common, but there are certain situations where you will need to give an injectable medication to your pet. So that might be an animal that has diabetes that needs to get insulin injections. It may be an animal with kidney failure that needs to get subcutaneous fluids. There are a few other medications that we might give injectably. There's a joint supplement that lots of different species can benefit from that's given by an injection. So you may find yourself at some point having to give injections to a pet. The first thing I just want to clarify is what type of injection you might be giving. So in general, most injections that you're going to give at home are going to be subcutaneous. That means just under the skin. So you're not going into the muscle. You're not giving it in a vein. You're just getting right under the layers of the skin and a little bit of subcutaneous fat. And you're giving it right underneath that in the kind of the space between the fat and the muscle. Usually muscle is right the next layer down. So subcutaneous is generally the route that you're going to be giving any kind of injection at home. Pretty rare that you might be sent home with an intramuscular injection, although you might, especially if you have large animal pets like horses, you might be giving an intramuscular injection. A lot of people will say IV when they're thinking of having given like subcutaneous fluids to a pet. So you're giving like a large dose of fluids, and people will call it an IV because when we go to the hospital and we get fluids, we get it through a vein. So IV stands for intravenous, and you are not giving IV medications or fluids to your pets at home. In general, you should not be unless you are actually a trained animal health professional. So we shouldn't be putting needles in veins or catheters in veins at home. So don't use the term IV because it can be a little bit confusing if you're talking to like the vet assistant and you're like, oh, we're giving them IV at home. You're probably giving sub-Q fluids. So sub-Q, short for subcutaneous, and that is by far the most common route that you're going to be giving insulin or any of that other kind of stuff. Fluids at home to your pet. So if you are talking with your vet about your pet needing to have regular injections of something at home, firstly, make sure if you have a phobia of needles or you're going to pass out at the sight of a needle, don't be shy about telling your vet that. I have had a couple of clients who have said, absolutely not, that is not going to happen. I have a very close friend who will pass out at the sight of a needle. So I understand that. You do need to be clear with your vet if that's like, wow, I can't be around needles. That's not an option. And we'll have to come up with an alternate plan. But hopefully, if you're just a little nervous of it, you've never done it before, it freaks you out a little bit, try to give it a go because you'll find once you get used to doing it, you realize, oh, like this isn't actually that scary and I can do it and it's going to help my beloved animal, so it's worthwhile giving it a try. Be extremely careful that you're following your label instructions very closely. If you're giving especially insulin, you absolutely do not want to overdose insulin. That can be deadly. So be very, very careful. When you're giving fluids and you're giving a large amount of something, you definitely don't want to be giving too much. That's pretty rare that would happen. There are a couple of other medications that you might give by injection at home. It is very important that you are getting the dose correct. You're using the right type of syringe, again, especially for insulin. There are a couple of different types of syringes and they measure the amount of drug differently. So you do want to make sure that you're using the right kind for the type of insulin that you have. Handle needles with care and be sure that you're ready to dispose of those properly. Don't poke yourself. Be calm, be relaxed when you're handling needles. Don't be in a rush, definitely, and make sure that you have a sharps container. Your vet should provide you with one. And you can also get them through pharmacies. If you're getting your medication through another pharmacy, usually can get a sharps container there as well. And make sure that you know where to return the sharps container to. So usually if it went home with your vet, you should be able to return it there, or they may give you like a mail or something like that where you're going to be returning that for disposal. Make sure that you get a good tutorial, that you have had a proper, thorough in-person tutorial with staff at your vet clinic. So if they send you home an injection and just kind of tell you how to do it, that's not adequate. Make sure that they're scheduling an in-person tutorial for you and that they're going over every step with you so that you feel comfortable. And usually what we'll do in my hospital is the technician or assistant will do kind of a demo, and then we'll have you actually do the injection, so that you get that first time of actually physically doing it in the clinic with a staff person, so that if something doesn't go right or you're having trouble, they can be right there to help you troubleshoot. So that is definitely ideal. Then when you get home and you're having to do it for the first time, you might want to look up like a video on YouTube. Just make sure if you do that, you're watching a video that is made by veterinarians and not by a random person who might not actually have the training that they need to be sharing information with you. So do make sure that it's a vet or a vet tech who is doing the instruction in the video, or if your vet has a video that they can share with you so that you can refer back to it if you get home and you're like, I completely forgot everything that they said. I don't know what I'm doing. You definitely want to feel confident that you know how to proceed when you get home and you have to do it all by yourself. Speaking of all by yourself, if you do have someone who can hold the pet and or be giving treats, that's definitely very helpful when you're going to be dealing with a needle around the pet, especially if it's a small and wiggly animal. That can be very challenging. If you have a bird that you're going to need to be giving fluids to, especially a bird that likes to use their beak on flesh, you do want to make sure that you have someone there who can properly restrain the bird. And that's something that, again, you want to make sure that your vet has gone over with you how to safely and effectively hold a bird when you're going to be doing something like giving an injection. If you haven't had to hold them before, you're generally restraining a bird by holding them around the neck. And you do need to know how to do that properly so that you're not causing any harm or discomfort to the bird. But you do have a good firm but gentle hold on the bird. And same for, some of the reptiles and other little creatures that might whip around and try to bite. If you're poking them with a needle, you do want to make sure that you understand how to properly hold them before you give the injection. If you're giving a large injection, which is generally that's going to be subcutaneous fluids that you're giving for a dehydrated animal that's sick and going through a recovery process, or that has chronic kidney disease and you're going to be doing this regularly, I recommend warming the fluids up first. If fluids that are at room temperature are quite cold underneath the skin. So putting them underneath the skin, especially of an animal who runs several degrees warmer than we do, like a cat, that's really, really cold. And that's not great, especially for an animal that's already sick or debilitated, or that's an older, a senior geriatric kitty cat with chronic kidney disease is the number one most common animal that's going to be getting sub-Q fluids at home. Warming that fluid up is going to make it so much more comfortable for them. It's going to be less stressful for them, and the whole process is going to go more easily. So try to warm your fluids up first. You can do that by putting them on a heating pad for 10 or 15 minutes, shaking them several times so they get kind of evenly warmed, or put them in a bowl of hot water. Just make sure that the injection port and the line are not in the water. You don't want water seeping into any of the spots where like the line is plugged into the bag. So make sure that stays up out of hot water. And then you want to definitely shake it around, make sure to check the temperature on your wrist. You can open up the line and empty out the cold fluid from the line until you feel the warm. Check it on your wrist, make sure it's a nice, comfortable warm and not hot, and that you've shaken it up so there aren't any hot spots in the bag. But definitely warm it up. Everything will go much more easily. You also, if you're giving a large dose of something like fluids, you're often going to be given a very large needle to poke into your often small animal. So if your animal is very reactive to the poke, you can get a topical lidocaine that you can rub on the skin and let it sit for about 1 to 2 minutes, not too much longer because it will start wearing off in about 5 minutes. But you can rub that on the skin, wait a good solid minute, make sure that you are then poking your needle right into the spot where you rubbed that stuff. You can get that over the counter, or you can ask your vet about purchasing it from them. But it is available over the counter, a lidocaine or a lidocaine prilocaine combo. It comes as like an ointment or a cream. You don't want to use too much, so do be careful if you are applying that kind of stuff. Don't put a big giant swath of it on the back of your animal. Put just a little dollop and, part the hair in that spot and kind of smooth it out with using the ointment so you can see it easily. If you use a really large amount of that, there is a chance that the animal could have an adverse reaction to it, and we definitely don't want that. We don't want them getting enough of it that they're actually absorbing a dose through the skin, like with our transdermal medications. We don't want it going systemic, and that's rare. As long as you're using a really small amount, that's safe in general, unless, of course, they have an allergy to topical anesthetics or local anesthetics. So be aware, always be watching, again, any medication that you use on an animal. Potentially they might have an allergy to it or something like that. But if you use it in a little spot, see how that goes. Oftentimes that makes the whole process of giving injections much less stressful and more comfortable for your little creature. So we use that quite a lot in our clinic when we're doing blood draws or vaccines on really sensitive animals and that kind of thing. And it really does help a lot. We use it when we're putting in a microchip in an animal that's not anesthetized, because that is a giant needle, and it really does help. So I definitely recommend doing that too, if you have an animal that's really noticing the poke and flinching and that sort of thing. I mentioned having someone to help hold, and I want to just go back to that for a minute. If you are giving the injection and you can have somebody holding or just handing treats to the animal to keep them distracted, that's really helpful. If you're giving a really small injection and you're able to use a really small needle, like say you're giving insulin, you may be able to just have them eating some treats and walk up to them and give them the injection and kind of walk off. That's how I give my cat his joint supplement injection. He doesn't even notice that I'm giving it. There are definitely ways to distract them if you're giving a really small injection that's just going to take a couple seconds to give. It's also helpful to kind of desensitize them to having that area of their skin grasped. So especially cats who may have been scruffed at some point in their life in an unpleasant way. For adult cats, being held by the scruff is not the same as when they're little tiny kittens and their mama is picking them up by the scruff. So if you grab an adult cat by the scruff, that is generally an aggressive maneuver, and they generally have a stress reaction, which is either to freeze, and so often people think, oh, it puts them in a trance and they feel relaxed and safe. That they don't. They're doing a fight, flight, or freeze kind of response, and they're doing the freeze part. With a lot of cats, they'll get like really aggressive when you try to grab them by the scruff. And oftentimes, we are giving our subcutaneous injection right around that spot. So when you go to pick up the skin to put your needle in there, some cats might go, what are you doing? And then get really stressed out by that. So it's a good idea to do a little petting. We're just petting you, we're scratching, and then kind of just get them used to, like, I'm going to just pull up your skin a little bit and make a little tent. And just do that a couple times and then be petting them, and then do that a couple times and then pop with that needle. Try to give it in one smooth movement, get used to kind of popping it in there, knowing how deep it needs to go, give that shot, and then you're done. And don't kind of mess around and be like, whoa, put it in really slowly and carefully. Like that's going to make it more painful. So if you can pop it in there, give the injection, get it back out, and then be petting your pet and giving them some treats or other positive reinforcement that they like. Try to make it as low stress as possible. Then everything should go pretty smoothly. And the more you do it, the more comfortable you'll get with it. Like I said, I can walk up to my cat. I put a couple treats in front of him. I do that little desensitizing of the skin over his neck, pop that injection in, pet him a little bit, and he doesn't even know anything happened. Now, if your pet just absolutely refuses every method and you're having a difficult time, you're not able to get medication, there are some animals that are just so averse to having their mouth handled. They're super reactive. They're trying to bite you. You're tense, they're tense. It's not going well. Then you need to talk to your vet about an alternate method. So, sometimes it might be, okay, we have an animal on antibiotics and it's not going to happen. We might need to turn to that long-acting injectable antibiotic if that's an appropriate choice for whatever the infection is that we're treating. Now, unfortunately, we don't have a lot of choices with that, a long-acting injectable antibiotic. So if it's not the right antibiotic for that illness, your vet might say, I'm sorry, that's just not an option. So don't be mad if your vet says we don't have that option, because it's not that we're trying to withhold it from you. It's just that for some types of infections, that antibiotic just isn't going to work, and it's not cheap. So that's another issue with it, is that it's not those long-acting medications tend to be much more expensive than an oral version. But for some situations, that might be a good option, and it might really reduce the stress level in your home. And, if we have an animal that's sick and trying to recover, if they're getting super, super stressed by being medicated every day, that's not helping them recover. So we do want to try to minimize stress in an animal that's trying to heal from some illness or injury. So, if the whole act of getting medication into them once or twice a day is making them severely stressed, well, that's not good for them either. So, if it's just not going well, then we might need to turn to something like that. Or there might be a compounded version of a medication that's going to go better. So, potentially a transdermal medication, like I mentioned before, that you just need to rub on the skin. Or there might be something else that can be done. There might be some other option for treatment that we can turn to in the case of an animal that's just really difficult to medicate. Or in some cases, there might be a staff member at the clinic, or there might be another service in your area where there's a vet tech who does mobile visits and can come and medicate your pet. They're going to charge you, of course, because they need to make their living. So, that service is going to cost you extra money, but that might be an option. So that's always something that's worth looking into if you have an animal that's going to be on a short-term medication and you just need help. So sometimes somebody who does it 50 times a day will be able to medicate your impossible to medicate animal. Sometimes not. Sometimes they're just really, really difficult and they are not going to cooperate and it's just not going to happen. It's very, very rare that we can't somehow figure out a way to get the animal medicated. But there are some of those cases. There are some animals that have a chronic or recurring condition that needs frequent treatment. And it's so stressful for the animal that it's affecting the bond between the animal and you. And it's worsening their quality of life. So these are really, really rare situations, but I have come across them a couple of times where we've simply had to make the decision that we can't medicate this pet. We're going to do our best to manage them and keep them comfortable. But when we have an animal who's so upset by being handled for medication, and it's so incredibly stressful that they've stopped interacting with the person. They're hiding all the time. They're not eating well, just from the stress of that interaction to try to get medications into them. We may not be able to medicate them. And that's really tough to make a decision we're just not going to do it anymore. And we're going to see how they do. And in some certain disease processes, that's not going to be appropriate. And if we really can't medicate them and they're going to be painful or miserable, then we need to talk about, do we have any other options, or is their quality of life just not going to be sustainable and we need to consider potentially letting them go? I've rarely ever been in that situation, but there are times when we get to that point with an animal where they're just not going to tolerate being medicated. And that's a really hard place to be, but sometimes that we need to make that decision, either to stop medicating them, and maybe they're a little bit uncomfortable, but they're more comfortable than they would be with us trying to medicate them. Sometimes that's the trade-off that we have to make. But always do have the conversation with your vet. What else might we be able to try? Is there another option where we could keep them comfortable? If it's a pet with arthritis, they're having difficulty moving around, but they won't take pain medication. You just can't do it. Maybe we could work with, laser therapy and, heated orthopedic beds, and maybe they'll take some joint supplements, or they'll take a prescription diet that's got the joint supplements in it. Maybe they like that food and they'll eat it, and we can support them in all these other ways. So there often are other options. We just have to be creative. We have to take it animal by animal and do our best for each animal and what they will tolerate and what they won't. But oftentimes it comes down to us just training ourselves to be relaxed and calm and develop the skills to get the medication into the animal quickly and smoothly so that it's then not stressful. And if it's a little stressful for 30 seconds, that's not that big a deal. If they turn around, if they're like, I hated that, it was awful, and then they turn around and take treats, we're going to be okay. So a little bit of stress in order to make sure that they're comfortable and they're healthy, that's okay, as long as they're recovering from it quickly. Let's talk a little bit about what to monitor for when we've got an animal on medication, just so that you're kind of familiar with, the difference between an adverse effect and a serious reaction. So there's always the potential for any individual to have an adverse reaction to any substance that we put in their body. So firstly, be aware, any medication that you give your pet, if it's new, it's the first time they've had it, you do want to be monitoring them closely the first few days for any signs of an adverse reaction, and especially over the first day. So if your pet actually ends up having an allergy to a medication that we give them, or a hypersensitivity, and they have a severe reaction, that generally is going to happen very quickly after we give the medication. So that will happen within the first day, and it's often within hours or less. And this is the same for, they get an injection in the clinic or anything like that. And anything that we put into a body, the body potentially can have a bad reaction to it. And we unfortunately do not have a way to predict when an individual might have an adverse reaction. I wish that we could, but we cannot. Only in the case of like an MDR1 mutation, which is a mutation in one of the genes that codes for an enzyme that is very important in the metabolism of a wide range of drugs. There are certain breeds that are prone to having an MDR1 mutation. And your veterinarian will probably recommend that you do MDR1 testing if you bring in your pet of that breed, like a new puppy or something. But it can happen in any individual. So just because they're not one of those breeds doesn't mean they're definitely free of an MDR1 mutation. Any dog or cat can have that. As far as I know, we haven't identified that in other species yet. So it's rare in cats and it's semi-rare in dogs, except in those a few breeds that tend to be a little bit more prone to it. So if we know that an animal has an MDR1 mutation, we're going to avoid certain drugs because we know that they're at high risk for having an adverse reaction. But aside from that, it's called an idiopathic reaction where we're not expecting it and we don't know that they're going to react that way. So if your pet does have an adverse reaction to a medication, firstly, know that it's not that the medication is unsafe or that it was inappropriately prescribed. It's that we just can't know in advance if an individual is going to have an adverse reaction to a medication. So you may end up being, and this could happen to you too. This isn't just for animals. I have taken medication before that I had a severe adverse reaction to. And my doctor wasn't expecting it. I wasn't expecting it. And it wasn't because there was anything wrong with the medication. It was just my body didn't like it. And that can certainly happen with pets too. It's not common. It's actually extremely rare to have a severe adverse reaction like a hypersensitivity or anaphylactic reaction, but it can happen. So it's important to be watching whenever we give a new medication to a pet to be looking for signs of a serious reaction. And so that would be oftentimes swelling around the face and neck. If you're seeing that, that is bad and that needs to be treated right away. A sudden onset of very rapid breathing, especially in a cat, or a bunny rabbit, if you have open mouth breathing, that's not good and you need to call your vet right away. Of course, dogs will open mouth breathe or pant pretty frequently, and that's not necessarily a bad thing. But if you see your pet what looks like distressed breathing, really abnormal breathing pattern, and they seem very uncomfortable, that could be a severe adverse reaction. Severe lethargy, where they just are out, they're dragging, or very pale gums. And at any time you have an animal that suddenly seems very lethargic and they're just kind of dragging, always lift their lip if they have lips, look at their gums. If they don't have lips, you also can try to just look inside the mouth, open the beak or whatever parts they have, and try to have a look at the tongue. If the tongue or the gums are pigmented, you may not be able to tell their color, so you also can gently pull down the eyelid and try to look at the mucous membranes around the eye. Those should be kind of a nice bubblegum pink or a light, rosy pink. And if they're not, if they look super pale, that may indicate a problem as well. A sudden onset of like profuse vomiting, just really bad vomiting, that also can be a severe adverse reaction. So if any of those happen, and typically, like I said, that will be in the first day of a new medication, those need to get treated right away. Now, and like I said, those are extremely rare, so I don't want you to be afraid to give your pets medication because 99% of the time, they will have either no or mild side effects from a medication, depending on the medication. There are some that we know that are a little bit more likely to cause some side effects, but those side effects are generally manageable. So, more common adverse or side effects are going to be things like tummy upset. That's relatively common, especially with antibiotics, because they are going to affect the normal microbiome, the normal critters that live in the GI tract. And they also can they can have substances in them that are directly irritating to the lining of the GI tract and that sort of thing. So a little bit of tummy upset, a decrease in appetite, maybe a little bit of vomiting the first couple of days, that can happen, and that's usually pretty manageable. It might be that we need to, like I said, decrease the dose, or add on an anti-nausea medication for the first few days while the animal's adjusting to the medication, or we might just need to trade to a different type of medication. So do let your veterinarian know if your pet seems to feel really yucky after getting a medication, because we don't want to just keep giving it and kind of make them power through it. We don't want them to be feeling worse from the medication we're giving than they feel from the reason that we're giving the medication. So if they do feel really crummy, we want to do whatever we can to support them. So GI upset, and that could also be diarrhea. And oftentimes when they're having diarrhea, they feel otherwise totally fine. So as long as it's not severe diarrhea, we may not need to do a whole lot to get them through that, and that will generally clear up on its own. Or we might need to give them a probiotic for several days after having medication on board to kind of reestablish a healthy microbiome and get their stools normal again. Sometimes you may need to adjust the diet when you have an animal on medication if they're having just soft stools or like kind of milder diarrhea. If it's horrible blowout diarrhea or bloody diarrhea, that's bad, and we definitely want to treat that and potentially change the medication if they're having that level of tummy upset. Some medications may cause some lethargy, and sometimes that's expected and just going to be part of the treatment. So if they're on a certain type of pain medication or they're starting on an anti-seizure drug, they often will feel kind of lethargic and woozy for the first several days. But typically with those types of medications, their body will adjust to it. And usually within a week or so, if this is a medication they're going to be on long term, those side effects will ease up. So usually your vet or the staff that's going over the medication with you will kind of prep you for that and let you know that that's going to happen. Other adverse effects might be like increased appetite or a little bit of a decrease in appetite. If it's mild, that's okay. If it's a severe drop in appetite, that's not so good. An increase in appetite, we can manage that. Hopefully the animal is not already obese, because that can be very tricky. If they're not, you can feed them a little bit more just to make sure that they're comfortable. Some medications may cause increased thirst, and then, the downstream effect of that is going to be increased urination. So you need to be kind of ready for that and prepared to make sure that they have easy access to toilet facilities, whatever those may be for that particular animal, so that they can go more frequently if they need to. Some medications, when you first give the medication, may cause some salivating or retching, and that generally that means we need to hide the medication better. So it means that part of the medication is getting in the mouth and it tastes horrible and they're having that reaction to it. So if they're heavily, like they're drooling, foaming at the mouth, or kind of retching when they first get the medication, generally all you need to do is hide the medication. So like I said before, if it's a pill, wrap it in a pill pocket treat or some other kind of, piece of cheese or a berry or whatever, so that they're not having direct contact with the pill. And if it's a liquid medication and they're doing that, we probably need to change the form. So if it's a liquid medication that you're giving and it makes them start foaming at the mouth, we probably want to give that in a solid form instead, because there's not really a way around that medication touching their mouth. And that's what's causing them to have that reaction. It's that's happening directly in the mouth. And we need to give them a different form of medication, because that's just going to be miserable for them. And that can persist sometimes for like an hour. Some animals will be still kind of like salivating, and that's really uncomfortable for them. And that's not cool. So we probably want to give a different form of medication. There are then, potentially kind of weird adverse effects. There are some medications that can cause a drop in tear production, so dry eye. There are medications that can cause hypothyroidism, diabetes. There are some crazy things that can happen as a reaction to medication, and sometimes that's only with long-term use. Sometimes that's at higher doses. There's an antibiotic that can cause blindness in cats if it's given at too high a dose. So if, anything strange that happens with your pet when they're on a medication, if they start behaving differently, if they seem like they're not responding normally, anything strange that's going on, do call your vet right away, because it may be an indication that they're having a more significant adverse reaction. Now, some of those things are reversible, often like a type 2 diabetes that develops secondary to being on a long-term steroid or something like that, often the animal will go into remission once we stop the steroid and treat the diabetes temporarily. We often don't need to continue treating long-term because they actually get better once we've gotten all of that out of their system. So adverse effects definitely happen, and mild to moderate adverse effects are somewhat common. And in general, we're kind of prepared for that, and your veterinarian should kind of go over that with you. If they haven't, and sometimes they won't, you have a lot of stuff to discuss, and that ends up not getting discussed, feel free to ask them and or read the package insert or the materials that they've printed out so that you have prepared yourself for what to expect, and know when it's something more significant, when you should be calling the vet. And anything that makes you really, really uncomfortable with how your pet is doing once they're on a medication, feel free to call your vet. If you're giving a blood pressure medication and your pet is acting super woozy, they're kind of out of it or wobbly, that might mean that their blood pressure is actually dropped way too low, and that's not safe or healthy for them. So that's a time you definitely want to call your vet and say, hey, I think this is maybe we're over medicating, because we don't know for sure until they start taking the medication. So be watching closely those first few days that your pet's on a new medication, and be kind of prepared for what the typical adverse effects might be, and what's manageable and okay, and what needs to be treated, when we need to intervene. So be kind of ready for that. Make sure that you do let your veterinarian know, especially if you're going into an emergency room situation or you're seeing a new vet, if your pet is already on any medication, and if they're going to be prescribing medication, they need to know, because there are drugs that don't play nice together. We don't want to have a serious drug interaction that might be harmful to your pet. And also always be sure to let them know if you're giving any kind of other supplement, if you're giving like an herbal supplement or anything like that. Be sure to let your vet know before they send you home with any other medication. And if your pet does have an adverse reaction, a significant adverse reaction to any medication, make sure that you keep a record of that. So normally your vet will put an alert on the chart. Well, hopefully, I do. We'll put an alert on the patient chart that says they had a significant adverse reaction. Don't use this medication in this animal. But if you end up going to another vet at some point, that information may not translate over. So even if you send records over, that alert doesn't necessarily always go with the medical record, because of the way all of the different types of medical record keeping software work. Not all of them include those alerts. So be sure that you're letting any new vet that you're working with know, or like an emergency vet, if your pet has had a serious adverse reaction, and keep a record somewhere where you're keeping track of your pet's medical care, that so you remember, because 2 years from now you may have zero memory of the name of that drug. So you want to make sure you're like, oh, was it Medicam, or was it methimazole, or was it mirtazapine? Which drug was it? I don't remember. So make sure that you have that written down in a place where you can find it, hopefully where you're keeping all of your pet's medical records, so that to avoid that in the future. And always feel free to ask your vet as well if they're prescribing a new medication and you're like, okay, this is fine to give with this and that they're already on, right? And just make sure, because every once in a while, even if your vet knows your pet, they may space out that, oh yeah, they're taking this other thing that they've been on for the last year, that it just kind of slips the mind, because we're talking about other stuff right now and we've seen 10 other patients in the last hour. So don't ever feel like you can't ask. You always can ask, and you also in the medication information sheet that you get, there should be information about drug interactions as well. So make sure that you're storing your medications properly. If the medication needs to be refrigerated, if it's light sensitive, if you have little kids in the house, if you have dogs in the house that might get into stuff, make sure that you're keeping it out of reach. You're closing lids immediately. This is unfortunately a frequent issue, is the bottle gets knocked over and pills go everywhere, and somebody in the house who's a big eater comes along and scoops them all up. Then we could have a serious overdose problem. So make sure you pop those pills out of the bottle, immediately close the bottle again. Don't put a bottle back down on the counter without a lid on it. It's too tempting for fate to knock that bottle over. So just close it again immediately. And if you've got like a multi-pet household and you have different pets on different medication, make sure that you're keeping stuff organized. I recommend if you have you've got like 4 senior animals and they're all on different medications, like get little bins that have their names on them and keep your medications organized so you don't accidentally give the wrong medication to the wrong pet, especially if you've got, say, 1 pet on steroids and 1 pet on non-steroidal anti-inflammatories. If you accidentally give the wrong drug to the wrong animal, that could be very detrimental to them. So make sure that you're really keeping track of stuff. If you miss a dose of a medication or you give it late, if you've given it a little bit late, that's not a big deal. If you miss a dose and you don't realize it until the next day, don't double up. In general, you don't want to double up. You usually want to just give the next dose and just continue on. You can always check with the vet about the specific medication, but for most medications, you're not going to want to double up a dose. You're just going to want to continue on. And missing 1 dose every great once in a while is not a huge problem. If you're on antibiotics, it's pretty important that you don't miss a dose, but it's not the end of the world if like 1 dose in the course gets missed. If you're on a regular long-term chronic medication, usually missing 1 dose isn't going to be a huge deal unless it's something like a seizure disorder or serious chronic pain. If you have a cancer patient who has quite a bit of pain and they're doing well on pain medication, you definitely don't want to miss a dose. If you have a seizure disorder, you don't want to miss a dose because missing even 1 dose, that could allow a seizure to break through. So, and it's not like we're going to die if we have 1 seizure, but it's not ideal to experience a seizure. It is hard on the body, so we don't really want that to happen. So, do your very best to make sure that we don't miss doses. If you're going to be leaving town and you have a pet sitter staying with an animal who needs to be on regular medication, you want to make sure that you go over that clearly and that your pet sitter definitely feels comfortable getting the medication into the animal, especially if you have an exotic pet, if you have a parrot who might bite and that sort of thing. You want to make sure that you've established a relationship between the pet sitter and the animal and that they're definitely going to be able to give the medication. And you might want to consider, for an animal that absolutely must have their medication. If you're at all uncertain about a pet sitter, you may want to board them in a facility that has staff that are very comfortable giving medication and that will be really super on top of it. If you're just having like your neighbor come and check in on the pet, it's maybe not ideal. I mean, your neighbor might be awesome and they may do a great job of medicating your pet, but if you're at all unsure or they're at all unsure, it's maybe not such a good idea. You want to make sure that your pet is getting their medication regularly while you're away, because they're already going to be a bit stressed that you're away. And if they have a chronic illness or they're in the middle of being treated for something that, of course, happened right before you're leaving town, you want to make sure that they're feeling okay and they're getting their medication regularly. If you do have a pet who's on long-term chronic medication, you're probably going to be needing to take them in for, recheck exams and intermittent lab work and that sort of thing to make sure that they're on the right dose. If an animal loses weight or gains weight or the course of their disease has shifted, where either things are, progressing and getting worse, or maybe they actually have improved and they're much, much more stable, we may need to change the dose of their medication. And often the way that we're evaluating that is through blood work. So for certain long-term medications, you may be needing to bring your pet in like every 6 months for lab work, potentially every 3 months if it's early on in the course of treating a chronic disease. Or it might be something where they just need annual lab work to continue on something that they've been on for quite a long time. But it's important to make sure that you're following up with that kind of stuff and that you kind of know what to expect, especially when you're first starting, an animal gets a diagnosis and you find out, they're going to have to be on this medication long term. Feel free to ask your vet about follow-up. Like, what's this going to look like? Kind of be ready for we're starting a long-term chronic medication, there's going to be some kind of monitoring and follow-up. So be kind of ready for like, okay, what is this going to entail? If you have a dog that just got diagnosed with Cushing's disease, there's going to be quite a bit of lab work that's somewhat intensive over the first 6 months to a year. And then after that, it kind of calms down. So, and the same, hyperthyroid in a kitty cat, you may have several months of we're going to have to do repeat lab work like once a month for a month or two. If you have a diabetic pet, you may be having to do, these days, it's usually a wearable continuous glucose monitor, which is great, way better than having to do a glucose curve in the hospital. But be ready for that kind of stuff where you're going to have to be kind of monitoring and adjusting to make sure that we get your animal on the appropriate plan and the right dose and the right medication and all that kind of stuff. So if you have an animal with heart disease, you're probably going to have recheck x-rays intermittently and that sort of thing. So be kind of prepared for that and also for the costs of those things. So cost can be a big concern with the medication alone, much less the follow-up monitoring, lab work, all that kind of stuff. So make sure that you have kind of a good idea of what is going to be entailed with the medication that you have your pet on. If they have a urinary tract infection and we're on antibiotics for 4 or 5 days, you probably are going to need to do a follow-up urinalysis, but then hopefully we're done, right? Whereas if you have a diabetic pet, it's a whole different can of worms. So make sure that you're prepared for that. And if you go to pick up a medication that maybe at an outside pharmacy, oftentimes we're filling the medication in the vet clinic. A lot of stuff we have in stock and we send it home with you that day. And oftentimes our prices in the clinic are quite good. Hopefully they're quite reasonable. But every once in a while you may be able to get it a little bit at a better cost through a pet prescription program at an outside pharmacy or just using an outside pharmacy. Sometimes they manage to get a better price with the drug company than our hospital, your vet's hospital. So if you need to shop around, especially if you have a pet who's going to be on a chronic medication, you certainly can do that. Your veterinarian can do a written prescription or call out a prescription to another pharmacy for you if it's going to be a significant cost savings for you or it's much more convenient. I know Costco, I believe, has a pet prescription program, and some of the other drugstores. I think Walgreens has had, or Walmart, one of those, has had and may still have a pet prescription program where you can get discount on your pet prescriptions. Because a lot of us don't have insurance for our pets, or we may have insurance, but it doesn't cover medication. It depends on the insurance plan. And by the way, the insurance often is a good idea. You can go back to episode 1 if you want to hear a little bit more discussion about insurance for pets. But we'll also cover that probably in more detail in a future episode. But anyway, a little off topic. There are a couple of websites that you can also go to that provide like a coupon for a discount on medication. So GoodRx is the one that I'm most familiar with. You just go on goodrx.com and you can look up the drug, and then it'll bring up if it has a coupon for you at a certain drugstore, and then you just get the code or you download it, and then you go and get your medication at a significant discount. And that can be really helpful for particularly expensive medications like inhalers and that sort of thing. They're super expensive, and those coupons can just be lifesavers. Your clinic might also have an online pharmacy, and often their online pharmacy is like a group pharmacy, and so it may have better pricing than in clinic. So that's another great option if your hospital has an online pharmacy, and it can also be very convenient for doing refills for chronic medications or prescription diets, that sort of thing, because it'll get shipped directly to you. If you're using another online pharmacy, you want to make sure that it displays the verified internet pharmacy practice seal. So that should be somewhere on their homepage or their about page or something like that, VIPPS seal. So you just want to make sure that it's a bona fide pharmacy and it's not some random place that might be sending you stuff that's not actually the real medication. And unfortunately, there are places that do that where they will package stuff in the packaging that looks like the medication and it's not the real medication. So do be careful if you're ordering stuff from like an online pharmacy that you don't know. Generally the ones that are very familiar, Chewy and 1-800-PET-MEDS are probably fine, but do know that your veterinarian cannot guarantee any medication that came from anywhere else but their own pharmacy or their hospital's online pharmacy. If it's coming from your vet, it should be guaranteed it's coming from a drug distributor that is known, and we know that it's the real drug. If you're getting it from anywhere else, if it turns out to be something that's not the medication it's supposed to be, your veterinarian has no way of knowing that. So we cannot guarantee your medication if you decide to get it elsewhere. So just be careful with where, if you decide to get it outside of your veterinary hospital or their online pharmacy, just be careful with where you're getting it from. A lot of those other places, if you're getting it from Costco pharmacy, it should be fine. But if you're getting it from an online pharmacy, some of them are a little bit shady. So just be careful. And do make sure. So, kind of in closing, just always feel free to ask questions with your vet when it comes to medications. There's no silly or dumb question. It might be a question that your vet has gotten 50 times and they probably are prepared for it. So be asked questions. Make sure that you have the information that you want and need when you're starting new medications for your pet. If you're being sent home with multiple medications we're addressing nausea and pain and infection. And so, you're going home with 3 or 4 different medications. Make sure that you're clear on what's what it's for. And this is, I usually write in my discharge notes, I'll write the name of the medication and then in parentheses what it's for. This is anti-nausea, this is antibiotic, this is pain relief. So it helps you to remember, what am I giving this medication for? Why do I have to give 4 medications to my cat? Just make sure that you know what everything is for. And if you still have questions and you're not sure, send your vet an email or a text and get a little clarification or read the stuff that came home and that might answer your question. Hopefully you're getting some kind of a follow-up call from your vet hospital, but if you don't, if that hospital doesn't do that and you still have questions, contact them. If a couple days in you think your pet is having a hard time with the medication or you're having a really difficult time giving it, make sure that you get in touch. Advocate for your pet, advocate for yourself and for your bond with your pet. If the act of giving medication is harming the bond with your pet in a way that you think is potentially going to be long-term and detrimental to the quality of life of your animals, you need to address that. We don't want to just muscle through that. Medications are a tool to improve quality of life. So if they're not improving quality of life, if they're actually making things worse, we need to readjust. We need to go to plan B. And there are lots of plan Bs and plan Cs and things like that. Make sure that you have all the information that you need about how the medication should be given, how long your pet's going to be on medication, what kind of follow-up you need to do, and feel good that you're doing the best that you can for your pet. And it may be awkward at first and it may be a little bit of a struggle, but, take a step back, take a deep breath, evaluate how things are going. And if you need to adjust how you're approaching giving the medication to the pet, the confidence will come with some practice. The more relaxed you can be and the more confident you are in getting the job done and the more confident you are in the medication and what it's doing to help your pet, the better it's going to go. You'll get better at it. You'll get comfortable with it. And you'll learn some cool stuff about animal health and wellness along the way, probably. I wish you luck in your medicating endeavors. I know you can do it. It might be tricky at first, but I know you can do it. And do keep an eye out for those resources on my Instagram page to kind of help you muddle through medicating your pets. I will try to do a video soon too of teaching a bird to take a syringe. Happy medicating. Give all of your pets hugs and kisses for me. Thanks so much for listening. I hope that you'll follow the podcast and stay tuned for future episodes. I hope you enjoyed this episode of Dr. A for Animals. This podcast is for educational purposes and does not substitute for specific medical advice for an individual animal or constitute the practice of veterinary medicine. No veterinary client-patient relationship is formed through listening to the podcast. If you have an animal in need of medical care, please see their veterinarian.